This is a special edition of Late Night Health. I'm Mark Alyn. We're going to take a look at sinus congestion and allergies and other ENT issues with Dr. Jonathan Wiggenhorn. He is an osteopathic doctor based in Phoenix, Arizona. ENT. Let's first define what that is. Ear, nose, and throat. That's your specialty. Tell us about that.
Great. Well, thanks for having me on. I appreciate that.
Sure.
Otolaryngology. It's actually otorhinolaryngology, which is basically focusing on the diseases of the ears, nose, and throat. It seems like you would run out of things with only 3 organs to look at, but actually there's a slew of disorders that we have that we treat. We also, I'm also board certified in head and neck surgery, so that includes all the head and neck abnormalities, thyroid disorders, parathyroid, cancers of the head and neck, and stuff like that. So,
right. The nose is, I guess what we're going to concentrate on today, and the ears. If you can't breathe, you die. I mean,
this is true.
Right?
It's all the ABCs, airways first. So breathing is very important. Yes.
Yeah, it really is. And right now with COVID-19, a lot of people, they're checking their breathing because apparently one of the effects is to affect the lungs and your breathing capability.
Yes.
Have you seen anything or read anything or heard anything about that regarding, just general health?
Well, regarding COVID-19, it does affect the lungs significantly. That's why we've had people that, when they get really sick, they're needing ventilators, and it puts them into acute respiratory distress syndrome, or ARDS, and gives them difficulty breathing. Some studies that I've been reading, and it's been circulating in the ENT community, is that the COVID-19 virus is highly concentrated in the nasopharynx and the throat, which is, nasopharynx is the portion in the back of the nose. So that has really, impacted our specialty, because that's where we spend most of our time, is in the nose and throat. You just took out 2 of our 3 main areas. So, that's why we've gone to telemedicine. The American Academy of Otolaryngology has recommended that we do telemedicine unless it's an emergent issue.
What would an emergency be?
So anything that is going to, cause or intractable pain, a newly diagnosed cancer that can cause airway problems, an infection that, if you don't intervene, is going to worsen the patient, like an abscess, anything that would cause permanent cosmetic deformity, some sort of facial trauma, something like that. Those are the main things.
You live in Phoenix and I live in Southern California, and both areas are well known for allergies and sinus problems. And I think you said you grew up here in Southern California and have had allergy pretty much all your life.
Yeah.
What are some of the common things that people use to overcome this situation? I mean, I know there's allergy shots. There are neti pots, which I could never figure out because I get it all over me. Right?
Yes.
Hold the nose, it's right.
Yeah.
Then there are a lot of over-the-counter drugs, and I do want to talk about 2 specific ones in a moment. But are allergies really common in these 2 areas where you live, where I live?
They are very common. I did grow up in Southern California. I've lived in Michigan, North Carolina, and then I've been here for 10 years. And speaking about Phoenix and Southern California, we get a lot of sunshine. That's why a lot of people want to live here. And with sunshine, what's that?
play golf.
Absolutely. I mean, I've played more golf in the last 2 weeks than I have in 2 years. But because the sun's always shining, something's always blooming. And we are living in areas that people from all over the country have moved to. And when they move, they bring their plants. And so a lot of the things that grow, like in Phoenix, are not native to the Phoenix area. And so something is always blooming. The sun is always shining the majority of the time. And especially in the desert areas, we have no humidity, or very little. And with no humidity, there's nothing to trap the pollen to bring it to the ground. So therefore, it's constantly up in the air. And it's in the air, we're breathing it, and we're suffering from it. So,
do most people have allergies, or is it a small percentage of the population?
No, it's actually quite high percentage. Up to 60-70% of people can have allergies. And even then, it's a spectrum, right? It could be severe to mild. And a lot of people have allergy-type symptoms, but don't actually have allergies. They can have a non-allergic rhinitis. Rhinitis is basically inflammation of the nose that can cause nasal congestion, drainage, facial pain and pressure, and stuff like that, decreased sense of smell. And then, we get those patients in our office all the time. This is what I do. We do an allergy test, and it's normal. And they look at me like, your allergy test wasn't correct. And I'm like, yes, it was. You don't have allergic rhinitis. You have non-allergic rhinitis. And that can be due, like I said, from dust, smog, pollutants, change in weather, barometric changes, change in temperature, going from hot to cold. Laying flat can cause someone's nose to plug up. They get up in the morning, walk around, their nose is fine. So, stuff like that.
One of the things that hit me just now would be dust mites in the desert, right?
Well, dust mites are everywhere.
Yeah,
dust mites are everywhere. That is an allergy. And that really goes into the first line of allergy treatment is avoidance. There's some things you just can't avoid. You walk outside, you're even though our neighbor is growing, has a mesquite tree, and it doesn't have a mesquite tree in your front yard, your neighbor 2 miles away does, and guess what? You're still affected,
because of the pollen.
And the grasses get reseeded on the golf courses, or we're all affected.
Are there a lot of olive trees in Phoenix?
Oh, yeah. Mm-hmm. I used to live near Olive Tree Farm.
Oh, actually. My.
Yeah. They grew them and sent them. They grow everything here, and then they ship them all over the country.
Right. Right. Exactly. Yeah. Did the olive trees drive you nuts?
I am highly allergic to olive trees, yes.
But I do love olives.
I love olives, yes.
Right. I do love olives. Our guest is Dr. Jonathan Wiggenhorn from Australia ENT in Phoenix, Arizona. And we're talking about allergies, and we will be talking about, I guess, a revolutionary process that Dr. Wiggenhorn does, balloon sinuplasty. And we'll be doing that in just a couple of moments. I wanted to get some background first about, what we can do. I mentioned, let's talk about a couple of drugs. There are over-counter versions of both Benadryl and Sudafed. Is there a place for that with people who have allergies?
There is a place for it. Backing up a little bit to the first line of treatment is avoidance. So, and you mentioned dust mites earlier. You have to think of your bedroom as like the holy grail. You want to keep pets out of the bedroom. You want to keep doors shut. You want to use a HEPA filter. You want to change your pillows every 6 months. Wash your sheets in hot water weekly. And once avoidance is done and you're still having issues, then there's a couple different things that we start patients on. Typically, the first line of treatment for nasal congestion and drainage would be something benign or something that's not medicated, like nasal irrigation. And you mentioned the neti pot. And the pot, sometimes you do have to be really skilled and balanced and be able to stand on one foot and upside down. But there are different I really like, it's called a Neilmed bottle, and has just a simple bottle that you just lean over the sink and you squeeze. It goes up one side and out the other, and it really is a good way to wash out the nasal cavity. I was a general surgery resident for a couple years, and we used to say when we were treating infections, the solution to pollution is dilution. Well, the more you get out of your nose, the less your body's fighting against it. So,
no, wait, say that one again.
The solution to pollution is dilution.
Aha.
So
if you dilute it, the more you irrigate. Can you do that several times a day?
Yes. You can do it up to 2 to 3 times a day. I wouldn't say much more is needed. I would tell you that after I do surgery on patients, I have them do it about 4 times a day for, 4 to 6 weeks. But it's very helpful, especially if you just went out and mowed the grass, or you just, came in from a dusty area, just to get all that out of your nose.
Right.
Help your body just fight against the pollen.
And then what about over-the-counter allergy meds? I mean, every other commercial right now is or was for a major product, and then there are generics of those that are available as well. How do you feel about those, and do they work?
The first thing that I typically put patients on is an intranasal steroid spray, like Flonase, Nasacort, Nasonex, and they work well, and they are very safe. They're over the counter. They have been for, I think, probably 4 to 5 years now, if not, maybe a little less. Very little of that is systemically absorbed, so the majority of it stays in the nose. And the thing that people have to realize with that nasal spray is that you don't get the full effect until you use it for about a week. So I have a lot of people give up because it's not like Afrin or a nasal decongestant, which works immediately. And that nasal spray, nasal decongestant, Afrin, neosynephrine, those are ones you do not want to be on a daily basis. 3 days max, and that's it, because you can actually form an addiction to it. So I'm remembering a word that a doctor gave me once, rebound. It's exactly right. So inside our nasal cavity, we have turbinates. Turbinates humidify and clean the air we breathe. The turbinates, the inferior turbinates, the ones on the bottom, actually swell with blood. And they do so that when we breathe in air through our nose, it warms it up to our body temperature before it goes into our lungs. Well, those can really get swollen in response to allergies, like we talked about, dust, smog, pollutants, infections. Right. And the Afrin and neosynephrine are very potent vasoconstrictors. So they take those blood vessels and they shrink them down. So you get almost an immediate effect and are able to breathe through your nose like you've always wanted to, but when it wears off, those vessels will dilate to even greater than they were before, so it gets worse. So instead of using it every 12 hours, you go to every 10 hours, and then 8 hours, and then finally it's in your pocket and you're using it all the time.
Oh boy! And
so that's why you want to stay away from that.
And what about the pills? Are those? Is that the next step in taking care of nasal congestion that is constant?
Yes, it would be an antihistamine. And one of the first phases in our body's response to something we're allergic to is to release histamine. And that is what's going to cause itchy eyes, sneezing, runny nose, nasal congestion. So we want to take an antihistamine. Some of the more popular ones are Claritin, Allegra, Zyrtec, there's Zysol.
Some of those actually have generics now too, don't they?
They all have generics, yes. And those are the same medications now that you can get over the counter that used to be by prescription. For the most part, they are very safe. I personally have taken one every day for, I don't know, as long as I can remember, because I have such sore.
Well, you're only 24 years old, so how long could it be?
God bless you. Cameron's working miracles here. So, Yeah, no, I've taken it a long time. So, yeah, that the nasal irrigation, nasal steroid spray, and antihistamine is very routine to have patients just get them up to speed, and from there, I then dictate, what else needs to be done.
As we've talked, I try to stay away from big pharma drugs and use botanicals or herbal remedies. And I found a couple that really work for me. They turn out to be more expensive sometimes than a general, than even a generic big pharma drug. And they don't quite last as long. Are there any problems with some of these? You mentioned those before we started.
Yeah. So everyone's different, and some of those work great for people. And, naturopaths know much more about botanicals than I do. But I do know, and it's from personal experience, because I've tried a few along the way, is that a lot of those are made out of botanicals or made out of plants, right? They're made out of things, and sometimes you can actually feel worse when taking it because you're allergic to it.
Oh my.
Yeah. So, and there's not really a lot of tests out there that, we don't test for thistle and other, like I said, it'd be a naturopath to talk to you about that. But I can tell you that things like mentholatum or peppermint or something like that has been known to give us a feeling of being able to breathe better through our nose. It doesn't actually make it better, but it makes us feel like we're breathing better through our nose. So just like a small peppermint oil, or that's why mentholatum works, right? Underneath the nose. So you get that feeling that your nose is just opening up. And
my dad used to give us Vicks and
exactly.
Right?
Yeah,
Yours
exactly.
too.
That's exactly what I'm talking about. So, who cares if it does or doesn't, as long as you feel like it does, right?
I was going to ask, are there any downside to that?
No. I mean, Vicks, what Vicks unfortunately has done is mix that with the afrin and neosynephrine. So you have to be very careful that you're not taking something that's not good for you. But just, herbal remedies or remedies like that are fine. I see no problem with it.
However, if you have a very severe congestion problem daily, causing severe headaches, causing you to miss work, there's a revolutionary new procedure. It's not surgical. Can you tell us about that and what it's called?
Yeah. So that's called balloon sinuplasty or balloon sinus dilation. And what that is for people that suffer from chronic sinusitis. So chronic sinusitis, by definition, is someone who has a sinus infection for greater than 3 months that's not responding to multiple antibiotics, intranasal steroid sprays, nasal irrigations, and just about everything else that we talked about. You still have all the symptoms. We get a CAT scan, and it's full of infection. And what I kind of describe it to my patients that what you breathe through is your nasal cavity. That's like the hallway. And then you have rooms around the hallway. Those are your sinuses. And with inflammation, from whether it be from allergies or a cold, the door to those rooms sometimes will swell shut. And when they swell shut, the normal bacteria in our nose can overpopulate. And just the inflammation from that infection of the overpopulation or the bacterial infection we now have in our sinuses, that inflammation keeps that door shut. So your sinuses will not drain properly like they're supposed to. So we put you on antibiotics and the bacteria count will come down, so you start feeling good. You take it off and the bacteria count goes back up. So it's until we restore that natural pathway of the sinuses draining, it's not until we do that your sinuses are going to regain proper health. So it used to be, and we still do it. Trust me, I do traditional sinus surgery as well. And I think I mentioned to you earlier, I've had 3 sinus surgeries myself.
Is that how you became an ENT? Was that one of the
No, that's a
motivations?
long and complicated road. I felt like I was definitely in my right spot when I got into this specialty. I knew half of it before I started because I lived through most of it. But it basically, traditional sinus surgery is going in with steel instruments and making a pathway or a debrider to open up a wide hole in the sinuses so that it'll drain. And there's nothing wrong with that. But balloon sinuplasty has come along, and I started doing it when I was a resident. And just to give you kind of a very brief evolution, we used to do it in the operating room under radiography or fluorescence, basically the same thing they do for angioplasties in the heart,
which is expanding the veins or the arteries in the heart.
It's exactly the same premise. We would stick a guide wire up through, just like you stick a guide wire through the artery, and then over the guide wire they put a balloon, and then they dilate the artery. We put a guide wire in the sinus. We would then have to take a picture with a big, radio frequency machine, and then we'd have to have lead on and all this stuff to get it just right. And we inflate the balloon, deflate it, and things have come so far where studies show this is so effective, and we started doing it without radiographic guidance, and we started doing it with just lights, and then we started doing it in the operating room, doing it that way. Well, now I do the majority of that in my office, and I can do it under oral sedation. I can do it and with the patient awake, comfortable, minimal.
Maybe a little Valium or something like that.
So we give them some medication to take prior to getting here. Yes, we do give them some Valium, a little bit of pain medication, and then I have very potent nasal gels that are numbing agents that I just let sit in the nose for a good 20 minutes. By that time, they're numbed up. I can do injections to kind of give them a block in the nose so they don't feel anything. They don't feel the injections. And then I do the balloon sinuplasty.
How far up do you go? I'm curious. I mean, I'm thinking of my nose right to here. I mean, do you go up?
Oh, yeah. Everything.
Wow.
Yes.
All the way up into all the sinus passages.
All the sinuses. Sphenoid sinus, the farthest sinus back, we do that. I do the frontal sinuses, the maxillary sinuses. The only sinuses you cannot do with the balloon sinuplasty are the ethmoid sinuses, which are between the eyes. And that's because they are not two big rooms. They're like a condominium complex or apartment complex. They have a bunch of small, tiny rooms. So if those are involved, I will do a hybrid technique where I'll do the balloons on the sinuses that I can, and then I will do traditional sinus surgery on the ethmoid sinuses.
Got it. And besides, Phoenix is one big condominium anyway. There are tons of those.
It's like Southern California when I was a kid. So it looks like
here too.
Yeah,
here too. Our guest is Dr. Jonathan Wiggenhorn, and from Estrella ENT, and we're talking about something that can really help a lot of people, and it's really considered non-invasive, isn't it?
It's considered minimally invasive. The balloon itself is quite small, and it does move bone. But what we want to do in sinus surgery is we want to spare mucosa. That's a real buzzword, is mucosal sparing. We don't want to cut into the mucosa because that leads to scarring. Mm-hmm. So this actually moves, opens up the natural opening to the sinus, spares the mucosa. Everything is removed. The balloon does not stay there. There's no stent put there because it's actually moving bone. So the bone has actually been remodeled.
Wow.
And so then everything can come out, and now you have functioning sinuses and healthy sinuses.
And they drain.
And it shows that after 2 years, 90% of patients that go through this, that opening you've made is still there. And
wow.
Still functional. Yeah.
Following the procedure, do you feel congested or anything?
You will feel congested. Some of it is because of the medication that I gave you. I give you some medications kind of like Afrin. And we talked
Right.
about that rebound effect, right?
Sure.
So you'll get a little bit of that, but also just from going in and out of the nose with the balloon, with the camera. I also have image guided system here in the office where it's kind of like GPS. I can tell exactly where my instruments are within millimeters to different structures, which not a lot of doctors have. I also have virtual reality in the office where I can map out where I want to go before I get there or before I even start the case on the screen and on the computer, and then I can just follow it right when I'm in the patient's nose.
Wow, that's amazing.
Yeah, it's really pretty fun and really cool.
Yeah, that's really neat. I really have enjoyed our time together. What should people do if they think that this is something they need? They need to be examined, obviously, by you to have this. Is this a common surgery? Is it done throughout the country?
Sinus surgery is very common. To the extent that I do it in the office, not all ENTs feel that comfortable. It's been a process and evolution for me. I talked to you about how I do some traditional sinus work and the balloon. I also do septums in the office, septoplasties, turbinate reductions, nasal polyps, all that stuff. So finding an ENT in your area that feels comfortable doing all those things is important. One that does a lot of these cases is important. And just one you feel comfortable with, That
How many have you done?
What's that?
How many have you done?
Oh, goodness. 500 plus.
Wow. That's a lot.
Yeah.
Yeah, that's a lot. And it's you're perfecting this constantly. I mean, you've got all of the latest GPS systems for this to do that. And when people have this rearrangement in their sinuses, they don't suffer as much or at all from allergies and congestion?
So that's a very good question. And the reason it's a good question is because they still can. I mean, changing someone's anatomy with a balloon is not going to change their physiology. If your DNA is your DNA, regardless of what I move around in your nose.
Right.
So if you had allergies before, you're going to have allergies still. But your symptoms should be far less because you maybe have more room in your nose for things to swell, for things to expand before you become symptomatic. Your sinuses are not going to become obstructed and get an infection. It can happen, but the rates go significantly down. The frequency of infections go down. When you do get an infection, we're able to irrigate out the sinus, suction out the sinus. The duration of the infection, if you do get it, is much shorter. So there's definitely an improved quality of life having this done. But I don't tell anyone that it's 100%. Death and taxes, I think, is the only thing.
Yeah.
100%.
Right.
But
even taxes, they've been moved.
Yeah, right.
Right. Wait a second. So it's only death.
I gotta revise that one, I guess.
Yeah, exactly, Doctor. Thank you. You are in all the years that we have done this show, you're one of two, I think, ENTs that we've talked to. So I've got to ask you the little boy question.
Sure.
What is snot for?
Snot is an accumulation. Our nose actually makes about 1 liter of fluid a day. And it is there to lubricate our mucosa, the lining. We have saliva in our mouth. We have, as you like to call it, snot in our nose. And it has actually a lot of cells that our tissues slough to get rid of infection. We have little hair cells in the sinuses called cilia that are microscopic. And that mucus is secreted by those cells and then carries all the debris and all the stuff we don't want to remain in the sinuses out of the sinuses and then out of our nose. So,
all right. So there is a purpose for snot. course not.
Yes, it is.
We have the contact information up here on our screen right now. So if you want to, you can get in touch with Dr. Wiggenhorn. Give him a call. Check out his website. There's a lot of great information on there. There's even a video on there that you can take a look at. And of course, I think we're going to be up there too, so that you'll be able to learn more about this procedure, which I think is fantastic. It's great. It's minimally invasive, and works. So for the most part, will you come back sometime and talk to us about other nasal issues?
Absolutely.
Oh, ears. We got to talk about ear. Do you do a lot of ear work?
Oh yeah, absolutely.
Yeah.
Yeah. What would you like to know?
Make my hearing better. Come on.
Well, I need a hearing test, and I'll tell you why you're not hearing well, and then I'll give you your choices.
Well, after all these years of wearing these, okay, the ears don't work quite as well. And if you look at latenighthealth.com, we are partially, we've been a friend of Signia for a number of years now, because their hearing aids have helped me. They've literally changed my life.
Yeah.
And
hearing aids are actually very important. Hearing loss has actually been shown to have a link to dementia. Yes. So you do need to. It's not just it's a health problem, not just a convenience to hear. So it's very important. So I'm glad you brought that up.
And you insurance companies out there should pick up the tab for it.
Absolutely. It's sad to go throughout the day and see people that really need it, and it's just the financial barrier is too great sometimes.
It's I think a good set is $6,000 right now, or so. Well, that's
ours are a little cheaper than that, so shop around.
Yes, and now you're allowed to buy them. You go to you for the hearing test, right? Mm-hmm. And then you can shop and buy them online now. I think that's...
You can. You got to be a little bit careful just because of what model you're getting. A lot of times it's an older model, and so you got to do your homework. But we have audiologists here in the office as well that can help you. Right.
Good. All right. Well, this is Late Night Health. I'm Mark Alyn. Join us at latenighthealth.com. And, of course, look for us at iTunes, Google Play, and wherever fine podcasters hang out. You'll find Late Night Health. We'll see you next time. Bye-bye for now.